How does TNM staging impact pancreatic cancer treatment options? Imagine trying to solve a puzzle where each piece reveals more about how the cancer has spread. The TNM staging system helps doctors understand the size of the tumor, whether it has spread to nearby lymph nodes, and if it has metastasized to other parts of the body. This detailed picture is essential in deciding the best treatment plan. The size of the tumor, called the T category, plays a big role. Smaller tumors that are confined to the pancreas, classified as T1 or T2, are often candidates for surgery because removing them offers the best chance for a cure or long-term survival. Larger tumors or those invading nearby structures, labeled T3 or T4, might not be suitable for surgery. Instead, doctors may recommend chemotherapy or radiation, first to shrink the tumor and make surgery possible later. Lymph node involvement, known as the N category, also influences treatment. If no cancer is found in the nearby lymph nodes, called N0, the patient usually has a better outlook and may be more likely to undergo surgery. When cancer is found in 1 to 3 lymph nodes, called N1, or more than 4, called N2, it indicates a higher risk of spread and recurrence. This often leads to the inclusion of systemic treatments like chemotherapy to target microscopic disease that might have spread beyond the pancreas. The M category shows whether the cancer has spread to distant parts of the body. If there are no distant metastases, called M0, localized or locally advanced cancer might be treated with surgery combined with chemotherapy or radiation. If the cancer has spread to other organs, known as M1, surgery usually isn't helpful. Instead, treatment focuses on systemic chemotherapy and supportive care to control symptoms and improve quality of life. The stage of the cancer directly guides treatment choices. Early-stage cancers, such as those classified as stage I with small tumors and no lymph node or distant spread, are often treated with surgery followed by chemotherapy to reduce the chance of recurrence. When the cancer is more advanced but still localized, like stage Roman II or triple, doctors might recommend chemotherapy before surgery to shrink the tumor, making surgery more successful. If the cancer has spread widely, as in stage Roman IV, systemic chemotherapy and supportive care become the main options, since surgery cannot cure the disease. Recent updates to the TNM system, including the 8th edition, have refined how tumor size and lymph node involvement are classified. These improvements help doctors better predict outcomes and tailor treatments more precisely. Sometimes, they also consider tumor grade, which shows how aggressive the cancer cells look under a microscope, alongside TNM staging. This combination can give a clearer picture of prognosis and influence treatment decisions, especially in borderline cases. However, accurately determining the stage before surgery can be challenging because imaging tests might not perfectly show lymph node involvement or vascular invasion. That's why a multidisciplinary approach, including imaging, biopsy, and assessment of the patient's overall health, is vital to interpret the staging correctly and choose the best treatment. In summary, the TNM staging system is a crucial tool that helps physicians understand the extent of pancreatic cancer. It guides whether surgery is a feasible option, what kind of chemotherapy or radiation might be needed, and provides insight into the patient's prognosis. While other factors like the patient's overall health and specific tumor characteristics are also important, TNM staging remains a foundational element in developing an effective, personalized treatment plan. Always remember to consult with healthcare professionals for advice tailored to individual circumstances, as each case is unique.